Welcome to this virtual prenatal introduction for Children's Medical Group. We have put together this video for expectant parents to provide you some general information about our practice. We hope you find this information helpful and that this helps you make an informed decision on where to take your children for care. If you're interested in having an in-person prenatal tour, please call our office for an appointment.
Children's Medical Group has been open since 1947, and we have 3 offices: Johns Creek, Decatur, and Century Center in Atlanta. Century Center is our main Atlanta office and currently has 6 MDs, 3 nurse practitioners, and 1 physician's assistant. Our Decatur office has 4 MDs and 1 nurse practitioner, and our Johns Creek office has 5 MDs and 3 nurse practitioners. All of our providers are board certified.
In addition to pediatricians, our office utilizes advanced practice providers such as certified pediatric nurse practitioners and physician's assistants. Advanced practice provider is a general title used to describe individuals who have completed the advanced education and training that qualifies them to perform routine well checkups, manage medical problems, order and interpret lab results, and prescribe and manage treatments within the scope of their training. These providers work under the guidance of physicians. They see their own patient panel, but may also be available for visits with your child. If your provider is not available at that time that is convenient for you, just like with all the providers in the office.
If you are unsure which provider that you would like to see in our practice, you can check out our website. On our website, we have listed each provider and their biographical information that you can read. Also, you can ask your friends that come to our office for recommendations. Our support staff includes RNs, LPNs, medical assistants, and nurse extenders. Only RNs and medical assistants give vaccinations.
Well, child checkups are scheduled by appointment only during the week, and we are open from 8:30 until 5 p.m. Same-day sick appointments are available every day. Currently, all of our offices and providers are taking newborns as new patients. We don't double book appointments in an attempt to keep wait times down. If a patient requires more time and unexpectedly causes a delay, we may offer you another provider to see your child if available.
If you need to be seen outside of normal office hours, we recommend going to Children's Healthcare of Atlanta's ERs or urgent care centers, as they have expertise in caring for kids. If you need to be seen on a Saturday, our Johns Creek and Century Center locations offer urgent care appointments between the hours of 9 a.m. and noon. Decatur patients are also welcome to be seen at either of these locations. You can call the morning of to schedule an appointment.
Children's Medical Group is now pleased to offer telemedicine visits. Telemedicine visits can be invaluable for simple things like pink eye or rashes such as eczema or acne. We can also use telemedicine visits for follow-up for things like ADD, depression, or anxiety. If you are interested in a possible televisit, please call our front staff.
Children's Medical Group utilizes a patient portal that you can access to request appointments or medication refills or to view labs. There are also checkup-related forms on the portal that you can complete in advance of your visit that can be imported into your office visit note. Ask the staff at the front desk how to get signed up for the patient portal or sign up online. We also offer next-day online appointment scheduling for sick appointments with certain conditions. Please check our website for the criteria used when scheduling these appointments.
If you have pressing questions that need to be addressed between checkups or are unsure if your child should come in for a sick visit, we have a symptom checker online as well as sick care information available on our website. However, if you feel you need additional assistance, you may call our office during the day and speak to a phone triage nurse for advice. These phone calls are answered by RNs who follow specific telephone triage protocols.
For urgent matters that occur after hours, we encourage parents to use the symptom checker on our website first to see if your child needs to be seen urgently or if your problem can wait until we reopen. We do utilize the Children's Healthcare of Atlanta nurse triage line after hours if you still have urgent matters that need to be addressed when we are closed. If the CHOA nurse triage is unable to assist you, they will page one of our staff who is on call.
Our waiting rooms are divided into sick and well sections. Newborns also have a separate waiting area for the first 2 months of life and will be put back into an exam room directly from there. We also have a state-of-the-art laboratory that includes in-house testing for bilirubins, and that's the test that's used for jaundice. We also do complete blood counts, comprehensive metabolic panels, strep throat, influenza, cholesterols, glucose testing, mononucleosis, and urinalysis. Most of the labs can be drawn here and sent out to the reference lab. The advantage is that you don't have to be exposed to any other illnesses at hospitals or an adult lab.
We utilize Children's Healthcare of Atlanta, or CHOA's pediatric dedicated radiology service for our imaging. Because CHOA specializes in pediatrics, it uses less radiation and uses radiologists who are trained in interpreting imaging specific to children.
Referrals and billing are located in the Century Center and Johns Creek offices if you have questions, or you may reach them by calling our office. If your provider has recommended a referral to a specialist, the referral information will be emailed to you. Please check your spam and junk mail files if you do not receive your referral information within 1 business day of the referral being placed.
We offer several procedures in our office, including spirometry, which is a type of pulmonary function test, ear washes for west impaction, ear piercing, simple abscess draining, suture removal, urine catheters for collection of urine in infants, nebulizer breathing treatments, tympanograms, and orthostatic blood pressures. We perform vision testing starting at age 18 months and hearing at 4 years old. Our Children Medical Group website offers a wealth of up-to-date information from the American Academy of Pediatrics and the CDC. On our website, you can also find information on vaccine schedules, treatment of common ailments, developmental milestones, fever-reducing medication dosing, information on travel medicine, and so much more. Detailed vaccine information can be found in the resource section of our website and in the hanging folder posted on each room.
For checkups, our website shows you what vaccines and our labs are scheduled for each visit and what forms to fill out. This is listed under the Well Exam section. You can also click on your child's age to see the Bright Futures handout that discusses age-relevant information for the visit. If you would like additional information about each vaccine, you can find a link to a detailed fact sheet from the CDC called the Vaccine Information Sheet, or VIS, on our website as well.
At Children's Medical Group, our goal is to provide the highest quality of care using the most up-to-date, evidence-based medical recommendations for the care of your child. Amongst the most important of these recommendations is the need for vaccination. Vaccinations represent one of the greatest public health achievements of the last century, and it's estimated that up to 3 million pediatric deaths are prevented worldwide each year. As a practice, we follow the vaccination recommendations set forth by the CDC and endorsed by the American Academy of Pediatrics.
Now we would like to review some common newborn problems, starting with weight loss. It is common for newborns to lose weight during the first week of life before they start to gain weight. This is more common in breastfeeding or premature infants. Babies who lose too much weight often become too tired to eat, maybe become dehydrated, or may be more prone to jaundice. We will monitor your infant's weight closely over the first 1 to 2 weeks of life.
Jaundice is another common newborn problem. This yellowing of the skin and eyes is caused by high bilirubin levels. To monitor for potential complications related to jaundice, we may need to test your infant's bilirubin level, which can be done in the office. In most infants who have jaundice, the problem will resolve without any problems or interventions. However, some infants may need supplementation or special lights to lower the bilirubin levels. If the problem is severe, babies sometimes need to go to the hospital. Our goal is to try to intervene early to help prevent complications from jaundice.
Our office has put together a newborn book for expectant parents. This book is especially helpful for new parents as it reviews simple things like how to care for a circumcision and how to bathe your infant. It can also be a nice refresher for parents who already have children. You'll be given a copy at your newborn visit. It's also available on the website under the newborn section. Breastfeeding is encouraged and supported in our office. All staff are trained to help with common breastfeeding problems, but we can refer you to a lactation consultant if you need additional assistance. Circumcisions are performed by the OBGYN in the hospital, or they're done in the home by a religious provider.
If you choose us for your pediatric care, let the hospital know that Children's Medical Group will be your healthcare provider. The hospital may contact your provider if your child had complications that they need to discuss. This does not mean that you have to see that particular provider when you come to the clinic. Similar to most pediatric offices, we do not go to the hospital to examine your newborn, but rely on the excellent care the in-house hospital providers give to do your immediate newborn assessment and follow-up while you and your baby are at the hospital.
For your baby's first newborn visit, please call our office after leaving the hospital to make an appointment. In general, your baby should be seen within 2 to 3 days after discharge, or sooner if there were any newborn complications, significant weight loss, or jaundice. Please remember to bring your baby and the hospital newborn paperwork with you to your first appointment. This paperwork tells us about the course of the pregnancy and the delivery, as well as any problems to watch out for in your child. The paperwork also contains the testing number for the newborn blood test that the hospital performs so that we can later look up your child's results. A good way to remember this paperwork is to put it in your diaper bag when you leave the hospital and bring it all with you to your first appointment. At your first visit, we will be reviewing birth records, examining your baby, and going over common newborn issues.
At Children's Medical Group, we strive to provide the best care possible for your children following recommendations of the American Academy of Pediatrics and the CDC. Thank you for taking the time to watch this prenatal introductory video. We hope you found it helpful and that it helps guide your decision on where to take your children for their health care. We hope to see you in the future. Thanks.